What should a person do if they have friends or family that are struggling with mental health issues?
Being a friend or family member to a loved one who is struggling with mental health conditions is very difficult. Oftentimes, there is a certain level of taxation on wanting that loved one to get better and seeing them go through difficulties. Sometimes it's even more difficult because our loved one is not willing to get the help they need, and we're seeing them struggle. How do we help them? This is such an important question because part of the story as a believer, as a mu'min, as a Muslim, is actually that push to get help, whether it be physical or mental health conditions. We always are told to be able to get help for ourselves and our loved ones. I remind us of the hadith of the Prophet ﷺ, in which he reminds us and says, Tadawu ibadallah, seek out treatments, O servants of Allah, because Allah has not sent down an illness except that He also sent a treatment or cure. And in that case, we are told we must be able to get that help we need. But how do you do so if your loved one isn't willing? I remind us that one of the very first rules in therapy is that you cannot help someone who doesn't want to be helped. And I know friends and family members are listening to this thinking, what a terrible thing to know that you can't actually push someone to get that help. True, you can't, because they themselves have to want that help for themselves. And you will burn out trying to push them in that direction and they're not willing. But you know what you can do? A couple of things. One, you can inspire them to get help. How do you do that? Sometimes you need some extra help in doing so. Maybe there's someone that they're willing to listen to. I think of some of the elders of our community. When a younger person is speaking to them, maybe it's their child or someone younger, they're not really willing to listen. But maybe when you find someone who's of their same age background that they will listen to, that they honor and respect their opinion, you're able to get some leverage. So leverage the older person who is able to talk to your older family member, for example. Sometimes it's very helpful to talk about Islam. Maybe they're Islamically inclined, and so you bring out the religious conversations related to our history and our tradition of how advanced we were in the understanding of mental health and psychology and at the forefront. Maybe they are somebody who actually needs extra help because they're feeling so down and depressed and unable to actually take the next steps. So you could help in making the simple phone calls over to the doctor's offices with their permission to be able to get to that next step. And maybe you're able to bridge that gap. Sometimes it's none of the above. And rather, it's that they're not willing to do any of these things despite your best efforts. So what do? What you do is you get help for yourself. At the end of the day, you're willing and wanting to get that person help. So you should be willing to want to get help for yourself. Why do we say this? Because a loved one and a family member goes through a lot in carrying the illness or difficulty of their loved one. So get help for yourself, learn the techniques to be able to heal and cope with the difficulty that's happening in your household. And by doing so, you very well may inspire that person to break the ice and get the help that they need to. Inshallah.